So welcome everyone to our October wellness webinar, Women Healing Women and the World Wellness Webinar. And tonight we have our guest is Leisha Getson, and she'll be here about 7:30. She is a board certified thermographic technician. She's going to be discussing thermography versus mammograms. Her husband, Dr. Philip Getson, evaluates the images for you, and they actually not only send you a comprehensive report, but they send you a set of the photos and images in both black and white and color. If you're a senior citizen, I encourage you to ask about their discount. They are right here in Marlton on Brick Road. And Leisha also travels around to a number of places locally where she also does breast screenings. So I want to begin our evening, as I usually do, with our meditation, our May I meditation. So let's have everybody just take a breath and just let go of the day's events. And just become present with us here. Let's take our palms and bring them together in prayer position, right at the heart center. And then let's take them up to the top of the crown. And here we're connecting into the divine, and we're saying, may I know the truth. Our palms come down over the third eye, and this area governs our clairvoyance, clairaudience, seeing and hearing in high sense perception. And we say here, may I see and hear the truth. We come down off the lips, may I speak the truth. We come back down to the heart, may I speak the truth through my heart for all of humanity, and open our palms on that. So I'm just going to go over that one more time. So let's come together in prayer position. And we're going to begin by opening our high sense perception. We're going to come up from the heart right to the top of the crown. Trying to get my straight here. And here we're opening our direct connection to the divine, to the universe, through our higher self and intention. Let's bring the palms right down over the third eye, over the forehead. And here we're opening up our vision and hearing, our clairaudience, clairvoyant sense. May I see and hear the truth. We're coming off the lips, may I speak the truth. Coming back down to the heart, may I speak the truth through my heart to all humanity. So I just wanted to open with that brief 1 minute meditation. And let's go back. Before we get too carried away, again, remember I'm going to make a YouTube of this, so you have this with the PowerPoint slide. I wanted to mention that Johns Hopkins University researchers, they found that broccoli sprouts had the strongest anti-cancer agents. They have actually patented that ingredients. And they've licensed the Baltimore Coffee and Tea Company in Maryland to sell brassica tea and coffee with True Buck. So 1 tea bag of brassica tea or a cup of coffee contains the benefits of 1 container of broccoli sprouts. I interviewed Tony Talale, CEO of Brassica, and he offered this 15% off and free shipping on a one-time purchase. And you can only use this code through TrueBrock, www.truebrock. So I just want to say that I have found their products to be excellent. I use the green tea decaf, orange flavor, and they have regular green tea, and they also have a number of flavored coffees. Their teas and coffees are reasonable, and again, you have that one-time 15% off coupon and free shipping. That's a bonus. So if you're interested in, drinking your cup of broccoli every day instead of eating it, that's an easy way to do it. And of course, as we get back into cooler weather, that hot cup of tea always tastes pretty good. So I just wanted to mention that to you. And I'm also going to go down here. I want to just speak a little bit about the coherent healings, because one of the things we're going to do at the end of the evening is what I call supercharged heart healings. And they are being done by Dr. Joe Dispenza. And they also partly originated with Lynn McTaggart's work in her book, The Power of Eight. And the idea is that one person is in the middle and there are 8 people around them. And I'm going to lead you through a little meditation, and then we're going to work with that actual supercharged heart healing for a couple people on the list tonight. So this is something that is having enormous success for both Dr. Joe Dispenza at his conferences. He's doing them at every conference. And Lynn McTaggart is doing these primarily long distance. And she's also having great success. And you can go into either one of their websites and get their newsletter and keep up to date with what they're doing. And those supercharged healings, as I said a minute ago, I'm going to guide you through a compassionate heart-centered meditation, and I'm going to remind all the people receiving that they're worthy to receive, and that all of us were born with those healing hands and hearts. So together we're going to raise that vibration, and we'll work with each person on the list. And I want to just mention that Dr. Philip Getson is really one of the, I would say, the most informed individual on thermography in the country. And he's located right here in New Jersey. He and his wife, Leisha, have been working together with thermographic diagnostic imaging for RSD and other issues, and in particular for breast imaging. And by the way, thermography is used a great deal in Europe, although we're still on mammograms here. Their company was established back in 1982, and actually Dr. Getson took his request to have the insurance companies cover thermographic diagnostic imaging for his RSD, his reflex sympathetic dystrophy patients. And it took him 10 years, and he even took it to the New Jersey Supreme Court and finally won for that to be covered. They've been, recognized in South Jersey Magazine and Suburban, and they were even endorsed by Christiana Northrup, who, as you may or may not know, is a famous woman author and gynecologist and written a number of books, and said that she has always opted for thermographic diagnostic imaging for breast imaging. So we're going to have a chance to have Leisha really talk to us about that a little bit more, and you'll have this available if you'd like to contact them. And I'm going to do some self-care, energy medicine, breast care tips for you since this is going to be our main topic tonight. And I want to stop sharing here so we can actually see those on screen. So, okay, let me change this to gallery view so everybody can see me in case you have any questions. So the very first thing I want to show you is tapping on the cheekbones. And the reason that we're doing that is that stomach meridian, which is a very long meridian, it starts at the cheekbones, it comes around the face, down the neck, it actually literally comes through the breast, and it goes all the way down the legs and ends off that second toe. So since it goes right through the breast in energy medicine, we've always come up to the beginning of stomach meridian and tapped on the cheekbones to help that area just kind of boost that spleen, which, remember, spleen meridian is feminine. She is the great metabolizer. She metabolizes our food, our feelings, our thoughts, our emotions. But the most important thing that she does for us is she fights infection. So I cannot emphasize again how important it is that we kind of pay attention to stomach meridian. So one very easy thing to do is just tapping the cheekbones, just tapping those cheekbones. And then the other thing that we want to do is literally tap the spleen points. So spleen meridian begins at the outside of the big toe. It comes all the way up the body, underneath the armpit, and ends right at the end of the rib cage. So I'm going to turn to the side here, and I'm going to put me on full view if you can see me here. I'm tapping right at the end of the rib cage, and you're really tapping as hard as you can. And I want to just check and see if anybody is a little tender. Anybody a little tender there? Or sore on these points? Yeah, okay. Yeah. Okay, I see Chris going, ah! So if you're tender, it just simply means that they need your attention. And of course, it's toward the end of the day, so our bodies have been running and going all day long. But spleen, the best thing that we can do to help support the immune system. And of course, we've just changed seasons. We're in fall, we're heading toward winter. So everything that we can do to keep that immune system strong is good for us. And of course, everybody knows that tapping their thymus is another great thing for the immune system. And you know, as we get older, the thymus shrinks. So well, Donna doesn't say tap, she says thump. You know, you're literally thumping that thymus for your immune system. So we did tapping the cheekbones because that's the beginning of spleen, and she runs all the way directly through the breast. We tapped on the side. And we also I added in thumping that thymus. Now, the other thing that we want to do is we want to go underneath the armpit, okay? And we want to massage all those lymphatic points every day. So this only takes a few minutes, but this is great. You know, if you're really a great exercise person like Lori is, you probably work your lymphatic system, but remember, you have more lymph in your body than blood. Okay, let me say that again. You have more lymph in your body than blood. So you need to work that lymphatic system. We're going right underneath the armpits because we're targeting that breast area. And this is really helpful any way and every way that we can work that lymphatic system. So I just said that the lymph system, we have more lymph in our body than blood. But remember, the blood has a pump to pump that blood through us. the lymphatic system depends on us moving and grooving in order to get that lymphatic system moving. The other thing that we can do is literally bounce those boobs, girls. Just get them bouncing. I'm just going to switch over here to gallery. I just want to see a few happy laughing faces. Okay, and then the other thing that I want to say is we can do the figure 8. So we're going to trace the figure 8 around the breast area. It's figure 8 represents the infinity sign. It represents endless energy. It is amazing. And so we can just really easily and quickly do that figure 8 around the breast about 8 to 10 times. So if we did that little routine, it only takes a minute or two to do it. So we're going to come up, we're going to tap the cheekbones. That was first thing that we did. Because this is the beginning of stomach meridian and it runs directly through the breast. We're going to come to the sides at the end of the rib cage, and we're going to tap, really tap vigorously for spleen. Remember, she's a great metabolizer. She metabolizes our foods, feelings, thoughts, emotions, and most important, she fights infection for us. Also, this will give us a little extra energy boost, okay? And then we're going to thump that thymus again for supporting the immune system since we're changing seasons. And we're going to come up underneath the armpit and massage underneath the armpit on both sides. And then we went in and we literally bounced our boobs to kind of, again, once again, we're working with the lymphatic system and then tracing that figure 8 around the breast 8 to 10 times. And so that won't take any more than 2 minutes of your time. So I encourage you to do all those, and that slide will be up on the replay. I put this picture up the last couple times because this is a young man, since we have some new people on. He is the first paralyzed human to successfully receive stem cells. And he's in a trial out in California, and they injected a spinal column with a huge amount of stem cells. At 19, he had a car accident. He woke up paralyzed from the neck down. They continue to work with him with stem cells, hoping to help him regain movement in the lower part of his body as well. And so there's a whole new field of regenerative medicine. People are opening centers all over the country, and that's going to be the latest thing. Also, there was a great article about things that they're doing at Illinois University with 3D printers, and here they are holding this heart-shaped heart with actual stem cells in it, and the cells actually interact with each other, and this is through a 3D printer. So we're going to see a lot more happen with 3D printing. And this is talking about the video that I did. It's about a 30-minute video, and it's all about crossing over the bridge from here to there, transcending consciousness from physical to universal. And on that video, I show some very easy energy things that you can do to help an individual crossing over, or if somebody has already crossed over, you can still work with them. And if anybody wants to order that or have questions about it, or if they have someone in that situation and they're not sure how to use it, I'll be happy to work with them. And tonight we're going to work with some of the same people that we did last week, and we're adding in Jane Sorflet. She is trying to learn how to walk again. She's in rehab, and she sent me a special email about joining tonight. And so we're going to, breathe in the power of love and exhale fear. Tonight, I'm going to lead you through that. And then here are some upcoming events. We'll have a wellness webinar November 21st. We're going to move it up a week because Thanksgiving is the following week. And then the last one, we're moving up a week, also be December 19th. That Chaos to Clarity coaching program, I'd love to talk to you about that. If you'd like to move forward, come join me and I'll tell you how we're going to work together. We have this monthly webinar, which people have the option to sign up for and be in our membership. And if you're interested in Reiki, continue to offer classes from time to time. Okay, so I'm going to leave this up and stop the share and come back here. So I just want to check. Hi, Leisha. Okay, you want to, wait a minute, let me unmute you. Okay, there you go. You're unmuted. So let me put you on speaker view. So how are you tonight? I just ran us through some energy medicine, self-care, breast tips, but I really want you to tell us all about thermographic imaging and what you do. So, Leisha, let me see. Okay, so you're unmuted. Go ahead, Leisha. Well, I'm not hearing you. Let me see. So see what you can do with your volume.
About 75.
Okay, a little higher. Yeah.
It's up at 100.
Okay, great. That's great. Everybody's got their thumbs up. They can see you.
Okay, good.
Okay, so go ahead.
Okay, so thermographic diagnostic imaging, we do infrared imaging. We call this a breast health risk assessment tool. So it's a...
Wait a minute. See if you can just make that a little bit louder. I'm trying to...
Let me see if I move this mic closer. I've got
okay, all right, that's better. Sure.
Okay. It's at 100%.
All right, yeah, that's better.
Okay. Should I start over? Did you hear me?
Yeah.
Okay.
There you go. We got you on full screen. Go ahead.
Okay. So thermographic diagnostic imaging is infrared imaging for, we call this a breast health risk assessment tool. So we're looking, thermography translates literally to heat picture. So if you have something going on in the breast, tumors forming, new blood vessels will be created in a process called neoangiogenesis. So new blood vessels will be created. They'll go to that area where there's a tumor growing. Those new blood vessels will create very distinct patterns and they'll create an increase in heat and temperature. So we're looking at the breast in color. We're doing 9 pictures in color. And we're looking at those color patterns, and then I'm taking 9 pictures in black and white. So my husband, Dr. Getson's looking at the color patterns themselves and then looking at the vascular patterns or the blood vessels for any lack of symmetry or patterns that would be indicative that there was a process going on. It's all non-invasive. There's no compression. There's no radiation. It's as simple as a woman is standing in front of my infrared camera about 3 feet from my camera. The most uncomfortable thing is the room is kept at about 68, 69 degrees for thermographic purposes. And then, as I said, I'm taking 18 pictures, 9 in color, followed by what we call a cold challenge. The patient holds an ice pack between her hands for 1 minute, and then I take the second set of pictures in black and white. And that's the long and the short of it, right? It's a beautifully simple test that does what it says it's going to do without causing any harm.
Right.
Yes.
So, Leisha, would you also tell us, I understand that they're using mammography in Europe and other countries, not even using mammograms. So can you speak about that, how it's being used around the world, and
Yes.
also how you use it with, for dental, for
Right.
RSD, etc.
Yes. Okay. So yes, thermography is used widespread throughout the the country. Japan, Poland, Germany has a big thermographic community. Switzerland has outlawed the start of any new mammogram clinics. So they're a little more progressive in Europe than we are here in the United States. So it's very much used there, and the communities are large. Um, they may do a mammogram every 5 years, or only if it's indicated there. The thermogram is their first course of action, and if there's a problem on the thermogram, they may go to an ultrasound, and the mammogram is kind of a last resort. Uh, so we also use, thank you for reminding me, we do thermograms for looking at thyroid, dental, facial. So many people these days with thyroid dysfunction, but the blood work is coming back normal. We look at the thyroid with the thermogram, and we can see whether or not it's functioning properly. Because of where the thyroid is located, we're also looking at the mouth. We're picking up dental infections that are being missed by conventional x-ray because it's a physiologic problem. They've got infection or inflammation in areas where there may be extractions from wisdom teeth, where cavitations are forming, or where root canals were done. They're notorious for housing infection. So that's been, and then we're looking at the sinuses too for sinus infection. But that's been really an amazing uh, add-on for the breast thermography, because if a woman is having problems in her breast, we've got 8 teeth connected to our mammary glands. 8 teeth. So if you've got a root canal or an infection in one of those teeth, and that infection goes systemic, you can end up with breast disease. And that is, in fact, how we started doing thyroid dental thermograms. I was doing a breast study on a woman. This was many years ago. And as a technician, I don't ever comment on the pictures, but there was such an obvious red line, bright red line, coming from her breast up into her mouth that I couldn't pretend I didn't see it, right? I mean, we were both like, oh my gosh, what is that? So I just followed that red line right up into her mouth. She went and she had it checked, took the pictures with her, and she did indeed have an infected root canal. The tooth was extracted, and she came back 3 months later, and we did another thermogram, and everything was moving towards clear. Everything was on the all clear. She came back another 3 months later, and everything was cleared up. So she prevented a breast disease by getting that root canal infection taken care of. The
Wow.
other, yeah, it was just amazing. Yeah. The other use for thermography that we use is the diagnosis of reflex sympathetic dystrophy, also known as complex regional pain syndrome. So for anybody who doesn't know what those disorders are, think of fibromyalgia and times it by 50. It's a debilitating chronic pain disorder uh, with numbness, tingling, burning, excruciating pain, and it's physiologic in nature. So X-rays, MRIs, all the anatomic tests are coming back normal. These poor people are being told it's in their head. They're being put on antidepressants when really that what they have is a physiologic or neuromuscular disorder. So that is for those folks that come in. It's priceless when they get a validation that they're actually, not that they want something to be wrong with them, but now they've got an answer and they've got a direction that they can move in with a diagnosis.
So for that RSD, you're actually treating clients for that. Is that correct? Like if you get those pictures and realize that's what it is, you literally work with those patients.
Yes, so Dr. Getson sees about, I don't know how many thousands of patients with RSD, or CRPS is now called. And we treat them with a varied methods in the office. We do use a, um, we have an infusion suite where we're infusing ketamine, which is an anesthetic drug, but it helps to break that pain cycle. So if you think about pain on a scale of 1 to 10, these folks are at 100, right?
Mm.
One patient described this as having his hand on a stove that was on while being electrocuted at the same time. So there's a vivid imagery for you.
Mm.
So we need to get that pain level down so that we can then start to treat them with other more holistic measures. And I'll do holistic health counseling with them. We'll talk about diet, lifestyle, stress reduction, meditation, all of that stuff. And the folks that we can get to that level have said, yes, they still have the pain, but they are it's bearable. It's they feel much more centered, much more grounded. So they're not knocked about by these um, stresses in life that we all experience. They are much better able to withstand them. So their cortisol levels aren't going up and down like crazy. They're just feeling. They actually say they feel overall wellness or better, even though they still have some of the pain associated with the disease.
Mhm.
Yeah.
So, Alicia, just to go back to what you said about the nutritional counseling, because I think you went through that integrative program. I mean, you're literally certified to do holistic nutritional counseling, and that what you do at the office is really an whole body, mind, spirit approach. So, talk a little bit about how you've seen that impact the clients that you work with.
Just having somebody sit down and spend when I do a holistic health counseling session, the first session is usually about an hour and a half. So it's very detailed. I like to say I do the broad strokes, right? I'm not a nutritionist, I'm a holistic health counselor. So uh,
Right.
first and foremost, just having somebody sit down and talk to you, that spending that amount of time where people actually get heard and listened to is important, as you know, right? Uh, and so we go through everything from what type of water they're drinking, what are they drinking their water out of, and then we get into the nitty gritty of what are they eating, processed food versus real food or organic foods. And I don't subscribe to any one diet other than eat real food,
Mhm.
and preferably organic these days,
Mhm.
right? Because of all the herbicides and pesticides and hormones that are in our foods these days. We've got to really be careful.
I like that real food. That makes a lot
Right,
of sense.
right. As my grandparents would have said, eat food. It was in those days they didn't have to say organic. They
Right.
didn't have to specify because it was. But these
Yes.
days, unfortunately, this is where we're at.
Mhm.
Um, so I do encourage people to eat organic when possible.
Now, I don't want to miss this because I have experienced the pod,
Mm,
and I'd like you to talk about that a little bit because I think you even have a special going with it. So
yes.
talk about I don't have a picture of it, but
Okay.
I feel like I'm in a little spaceship.
Right, right. Well, our pod people that's what they are. They come out of there and they're reborn out of the pod. It's a wonderful little infrared sauna. You're lying in it. The lid comes down, but your head is out. I wish I had a picture of it to show you.
Yeah.
You've got cool air blowing on your face. So you don't, people who are claustrophobic don't feel they're able to handle it because they've got that cool air blowing on their face. The mat that you're lying on, there's vibratory massage, upper and lower body. There's aromatherapy going on. There's oxygen therapy and music therapy going on all at the same time. So uh, going in the pod for 30 minutes gets what it's doing. It's heating the body on a cellular level. So the infrared's getting down into the cells. It's opening them up. It's getting everything oxygenated. It's getting those toxins moving out of the body. So you cut when you're finished. It's like a 30-minute workout. That's how oxygenated the blood cells are. It's also good for weight management, wound healing. Put you into, as you know, into a very nice meditative, floaty kind of state where you just feel wonderful.
Yeah.
You start out at maybe 20 minutes, 120 degrees, and then you can build up in time and temperature. But people just love it, especially now that we're coming into the cold months. Yeah, it's wonderful to go in there.
Yeah. Well, I wanted to mention that because, the holidays are not that far off, and it's something very unique and relaxing and stress reduction
Yes,
to
for sure.
give a friend or someone special,
Yes,
something totally different, and
yes.
it's very reasonable. So
Yeah.
I wanted
I
to mention that.
A lot of the people that I see will do that before a Reiki session with me. So they go in the pod for 20 minutes and they're all nice loosey goosey, and then they come in, they get a nice hour Reiki session, and it's really a nice treat. They
Oh, great
yeah,
combination.
great combination. Yes.
Yeah, yeah, Reiki's always great. So I just want to go into our gallery view again and see if I'm going to unmute everybody and see if anybody has any uh, questions for you or comments. Hi, Anne.
Hi.
Hi.
I have a question. If somebody has lymphedema, would the infrared, because of the heat, would the infrared be a problem, or would it be okay if you happen to know?
You know what? I would have to check on that. I think it would be okay, but I would want to make sure on that. So I would give
Okay.
a call out to the manufacturer of it.
Okay, thank you.
Yes. Thank you for the question.
Okay.
I'll make a note of that.
Yeah, lymphedema, yeah. Think about that. Yeah, Chris, go ahead.
Yeah, last year, both Carol and I had the thermography, and actually it was very thorough. I didn't understand everything, even when it was explained to me. I didn't comprehend
Did
everything.
you do your phone conference with Dr. Getson?
Oh yeah, all that was done, and it was very good. But I mean, I can't tell you what he said now. But in any case, I think it was very thorough and well worth it. Now, my doctor was given a copy of this, and several times that I've been in the last year to his office, he said, "Have you had a mammogram?" You know, the assistants to the assistants come in and give you, I don't know, a hard time. And have you had it? And I said, you know, if you just look into the file, you'll see that I had a thermography. A thermography, yes, is better than. And you need to look that up and study about it.
Right. Yeah.
Anyway, so the recommendation, I thought it was extremely thorough. And I did understand what the doctor had to say. And of course, you were, you know, going through the process of it. And that was easy enough. Easy enough.
Yes,
No big deal. But to get the general medical community, you know, to even respond that they have it in your records, it's like, hello, why don't you go read what the doctor wrote and then give him a call?
Yes.
You know, and so that can be frustrating in itself, because they just look at you like you're nuts.
Yes.
And frankly, you know, I didn't get, it was recommended for an ultrasound, but I never got around to it. So maybe give the office a call.
To come back.
Yeah,
Can I respond to that?
please.
Okay. So thank you very much for those kind words. I'm glad you had a good experience. And thank you for bringing up both of those points about the ultrasound. So if we find something on the thermogram, our next step would be an ultrasound.
Mm-hmm.
That's usually very good. We can provide a roadmap for the ultrasound people. They can go in and tell if it's just a cyst or fluid-filled cyst or milk duct or something like that. So non-invasive, not a problem.
Right.
The trick is getting you to a facility that will do the ultrasound if you don't wish to have a mammogram. We do have an ultrasound facility that will work with us in the Voorhees areas. Now, they're not going to be warm and fuzzy about it, but they'll do it for us. So
Okay.
yeah, right. But you bring up a really good point. We're a lot of the women are going up or hitting a lot of resistance from their healthcare practitioners, family members, friends, because you know they're saying, well, what is a thermogram and why aren't you getting your mammogram? I'm not going to. This isn't about bashing mammograms. It's about being able to make choices for themselves, for their own bodies, what that's in their best interest, that they feel comfortable with.
Mm-hmm.
If you choose to do a thermogram, and that's your choice as an adult woman, I don't think it's right that people are being belittled and yelled at and berated by their physicians. If you want to have a conscious conversation about it, Dr. Getson is always willing and happy to get on the phone with any practitioner, any doctor, and explain what we're doing. We're not in competition. We're an adjunct. We want to be part of. So that's what we've been trying to do, is really just have conscious conversations with physicians and just say it's not a we're not in competition. Let's work
Right.
together. You know, patient care is the priority here. So what can we do to provide the best patient care?
Mhm.
So I applaud all the women that do have the courage to do this, because we are, as I said, going against a huge medical paradigm, the cancer industry. And
Oh, yeah, it's a big business.
it takes some courage to do it, and to be able to stand behind your decision or your choice to do it.
Mhm.
Yeah. So thank you for bringing both of those two important points up.
May I ask something here? Since I never got the ultrasound, would it be advisable to have another thermogram?
If it's been a year, probably I would say to come in and have the thermogram. You know, if it it's time for your annual. At this point, let's bring you back in, see what's going on, see if whatever was questionable is
Yeah,
still there. And that could just be, it's like a fingerprint. That could just be you. Now,
who you are. And that was explained. Yeah, the doctor explained that. Yeah, it's just a precautionary measure, but you shouldn't be kept from having that. And all of this stuff is not covered. That's the thing.
That's
it's not
right.
covered, except maybe for the ultrasound over in Jersey. But he won't give me a thing to have it here. He won't give me a
Right.
script for it here. So
Dr. Getson can write you a script for the ultrasound, and the ultrasound is being covered in New Jersey. Unfortunately, for the thermogram, Medicare does not cover for the thermogram, and they set the standards, right? So everything is a trickle-down effect from there. We've sent them documentation after documentation after documentation, and they don't want to hear it. So it's going to be a patient-driven thing. I have been encouraging my Medicare people to just go ahead and send their claim forms in. It has worked with the other insurances across the board. The more they see them, the more people are getting reimbursed. So maybe we can just bring some awareness that women are making this choice. This is what they want to do, and you should be covered. You should be able to have that paid for.
Really, absolutely agree with that.
It's preventative, so that's what I don't understand. If it's preventative.
Not cost effective for them. That's why.
Well, you would think it would be more cost effective if we could perhaps prevent you from getting breast cancer, and all of that treatment that would go with that would save the insurance company a lot of money.
Well, ultimately, yes.
Right.
It's the smart way, but it's like politics.
We won't get into that.
No. Thank you very much.
You're welcome. Thank you for your input. I appreciate it.
Heidi, do you want to hop in and say anything?
Yeah. Hi, Leisha. I've seen you a few times.
Oh, yeah.
Yes.
Hi. How are you?
I'm well, thank you.
Good.
And living back in Philadelphia. So I actually do have a question, because I've been considering scheduling another appointment, and it's just so fascinating when I go down the rabbit hole of the internet. Of course, mammograms are all over the place. But my question is this: if if I were to get a mammogram and the results were questionable, would there be any recommendation at any point to get a mammogram, or that's totally out and only an ultrasound as like a backup test? Do you know what I'm asking?
Yes, I understand the question, and I appreciate your input also, because you've just made me think of something. So with the mammogram, here's one of the problems. We've got compression of the breast with 40 pounds of weight. Got radiation, which we know causes cancer. But the other issue is 9 out of 10 women have dense breasts, right? So that means the mammogram's going to be inconclusive. So they say, oh, you've got dense breasts, as if there's something wrong with you. No, there's nothing wrong with you. As I said, 9 out of 10 women have dense breasts. And I've got women in their 70s and 80s that still have dense breasts. So in New Jersey, there is a breast density law that says they're supposed to tell you when you're getting a mammogram that due to breast density, the results may be inconclusive. Well, they're inconclusive to the tune of 800,000 unnecessary biopsies done a year in this country. That's a lot of
Yeah.
that's a lot of people undergoing, and it's not a pleasant experience. I've never had it done, but I've had quite a few patients that have, and it's not pleasant at all. So they admit it's inconclusive. They talked about changing the guidelines to not start doing mammograms until you're 50 and then to do them every other year. So having said that, depending on your age, depending on whether or not you keep getting called back because you've got dense breasts, an ultrasound may be the better way to go. We like an ultrasound, as I said, because it's completely non-invasive. If we do the thermogram and we see something and we do an ultrasound and it's inconclusive, then maybe if the person is willing or wants to get a mammogram, we'll not say don't get a mammogram. If that's the I don't want to say one of the last tools that will be able to help, then you go for it. The other test that's great is an MRI, but that's almost impossible to get approved.
Right.
Before we get an MRI approved, they want you to have a biopsy.
Right.
Well, we're trying to avoid the woman from having a biopsy.
Right.
Yeah. We really leave the mammogram question up to the woman.
Mhm.
We're going to be here to support that decision and work with her in whatever she decides to do after the thermogram. You know, that's why we have the phone conference, and we're always available for questions, guidance, because we know that this is not the conventional route, and people need some help and guidance along the way with what to do next. Once you've done your thermogram, where do you go? What do you do?
Right.
Does that answer the question, Heidi?
Yes, I appreciate that. Thank you.
You're welcome. Thank you for the question.
Okay, so on the slides, I have all the information on how to get in touch with Leisha and Dr. Getson. So Leisha, give us that information, and it'll be on the slides as well.
Our contact information is, our phone number is 856-596-5834. Our website is www.tdinj.com. Email is tdi@comcast.net. So was it Ann who asked about the lymphedema?
Yes.
Yes. So Ann, I can check that out. Tomorrow's a rather busy day, but maybe on Monday I can get a hold of the manufacturer and find out if that would be appropriate for you, if you want to touch base with me.
Thank you.
That question. And our main office is in Marlton, New Jersey, 100 Brick Road, Suite 206, Marlton, New Jersey. But we have about 20 off-site locations throughout Pennsylvania and New Jersey.
Right. So yeah, double check and find out where they go all around New Jersey and Pennsylvania, also doing those, thermographic imaging. Okay. So you can also check on that. Okay, Lisa, thank you so much for joining us. It was great to have you. And I'm going to make this into a YouTube for everybody so that, we can look back on this and get any questions answered, or they'll contact you if they need further info. And we're going to go on to our, I'm going to mute everybody again, and we're going to go on to our supercharged heart healings for tonight. So I will be taking you through with the different people on here who's signed up. Yolanda, you're one of them. I've got you on the list. And we'll bring this up. Here is their information again with Leisha and Dr. Getson, and that again will be on the replay, and you'll have this, and I'll put it up also on the email I send out. So we're going to go down, and we're going to talk about our Healies, if I can get a hold of these slides here. So the Healies that we're working with tonight, Yolanda is on the show with us, And Jeanette is in Florida. Yolanda's in North Carolina. Jeanette is in Florida, and she is facing breast cancer surgery in November. She moved from New Jersey to Florida about 3 years ago, and so I was sorry to hear that. And Jane Sorflet sent me an email, and she is in rehab, learning how to walk again. She's been in a lot of pain. So also Peggy is on the call, and she and her husband Jordan are dealing with some health issues themselves. And Peggy's daughter Kristen is expecting her third child, and she's having some complications with the pregnancy. So what we're going to do is I'm going to have everybody get relaxed and just kind of get yourself relaxed and sit in the chair and sit back. And we're going to kind of warm up our palms to get that energy moving. And I'm actually going to be holding the prayer bowl. I have this great bowl that Harriet gave me that has, it's a crystal bowl with angels all around it and has all of the people that have asked for prayers. Karen is not on the call tonight, but she and her husband and the dogs are in here, and everybody who's asked for prayers is also in the prayer bowl. And you can always send me that information, and I'll be happy to put them in here. We hold the bowl every day and pray for everyone in here. So allow yourself to just kind of get relaxed. As I said, we're going to warm up our palms, and those people that are receiving, Yolanda, we're going to start out with you and just reminding all the people that are receiving healing, the healies, that you are worthy of receiving. And that's something that Dr. Joe Dispenza reminds everyone at the conferences that he's doing. And you can also, by the way, go on and look at, he has amazing testimonials of people that have been healed from everything that we can think of. So we just want to remind all the healies you're worthy of receiving, and that all of us here on the call that are acting as the healers, that we are born with these great healing hands and heart. So let's just kind of warm up our palms, close your eyes, and just take a deep breath. And just let go of, any issues going on for you tonight. Place one hand over the other at the heart and just breathe in the power of love. We're connecting with that heart center for each of the people that we're working with, and we're connecting in with the power of love, compassion, gratitude, and resilience. And as we open our hearts for each of these individuals, again, we're going to bring our palms together and just open our palms. And the first healie that we're sending energy to is Yolanda, and she's on the call. And she's going through some immunotherapy and is looking for this to be successful for her. And she's been doing great with all of the healing help that she's been receiving from Chris and Carol and all of her family. So just put our intention to send the highest vibration to Yolanda. And then just let's take a deep breath, let go, And let's move our intention and our healing hands and hearts to Peggy and Jordan. And the last time we sent healing to them, Peggy emailed me and told me that she felt great the next day and that Jordan's peripheral vision seemed to have improved. So again, we're going to just open our hands, our healing hands and hearts, sending that highest vibration to Peggy and Jordan. And then I want to add in Kristen, who's Peggy's daughter, and the new baby that's on its way, that she can get through the pregnancy easily. And then we're going to move our healing intention to Jane Surflet, who's in rehab and learning to walk again and dealing with her own journey. And finally to Jeanette Marinsky, who is facing breast cancer surgery in November with a double mastectomy. So our prayers and healing hands and hearts go out to Jeanette as well. So I'm also going to take a moment to hold the prayer bowl, and we're sending love and healing to everyone who's in the prayer bowl. Donna, who's a part of our group, is in here. She had some issues with her teeth, and everybody else that sent in their request, I just put the name and issue right on a little Post-it note and keep it in here. And after doing all my Reiki symbols in the morning, I hold this for whatever everyone needs. So we'll just take a moment to send our love and healing to them as well. Okay, everyone, I'm switching back to our gallery view, and I want to suggest that you just go back and hold your own hands over your heart and hold all of your being and love, honor, and reverence just as you are in this moment in time. That is an Elsie Kerns quote for you. So thanks, Yolanda. Thanks everybody for joining us tonight. And I probably won't get this out until either late this evening as a YouTube or tomorrow morning. But great to have you all join me. Okay.